will impact your health care coverage. Tomorrow is the deadline for the states to tell the federal government whether they'll set up their own so-called health insurance exchanges or let the feds do it for them. CBS 12's Chuck Weber is live in the studio tonight with a decision that will have a big impact right here in Florida. Chuck?
You're right, John. The exchange is a big deal because our state has the third highest rate of people without health insurance coverage. Governor Rick Scott, a staunch opponent of Obamacare, had said Florida would not create an exchange. But just this week, Scott said he's now willing to work with the feds. Have you heard of health insurance exchanges?
No.
Do you know what a health insurance exchange is?
No, and I haven't heard anyone talking about it.
Ladies have, of course, both heard of the Affordable Care Act, Obamacare, but that law's health insurance exchanges are not exactly topics of everyday conversation.
Good afternoon, Oasis. I'm your director, Paul.
Here at Oasis Outsourcing in West Palm Beach, health insurance exchanges are part of the daily discussion. So what are the exchanges?
So this is a place where medical benefits will be offered and where people can go in order to buy those benefits.
Oasis CEO Mark Perlberg. Oasis assists companies administering health care benefits for employees. For small companies, exchanges may become part of the equation. So who uses an exchange?
They're not working, or perhaps their employer doesn't offer medical benefits. The exchange is a place where people can go in order to purchase that insurance.
As for how the exchanges will work, Perlberg says that will vary state to state.
Will there be many different insurers offering plans? Will there be many different plans? There are questions associated with how will the pricing work? And the fact of the matter is, a lot of those questions are still open.
And Perlberg there says the questions will have different answers in each state, since each state is creating its own exchange. But each of these health plans that will be offered will have to comply with minimum requirements of Obamacare. As for Florida, if Governor Scott tomorrow says we will create our own exchange, we'll have to catch up in our planning. Liz?
Thank you, Chuck. And this, just in